Thank you all for joining us for this important update on the cyber attack affecting our healthcare system. Once again, my friends, our resolve is being tested. First by a virus, and now by an attack. As we've done before, we must rise together and not falter in the pursuit of resolution or justice. While it is an attack on a subnational, clearly the national, the federal government, understands this significance and has been fully engaged. This is not someone else's problem. It is everyone's problem. An attack on one is an attack on all, and we need to stand united. A technical briefing was just held for members of the media, and I'd like to continue to stress the importance of security concerns in communications as we go forward. Newfoundland and Labrador's health system is a victim of a cyber attack. Full stop. We are not alone. We have seen hundreds of these this year throughout Canada alone. Cyber attacks are increasingly targeting such systems as healthcare systems, and everything we say and do is being closely scrutinized. Our government will not share anything that could compromise or jeopardize the important work that is underway. I know that we all want answers. We don't have all the answers today. God, how I wish I did. We all want to know how this happened, who is responsible, who is behind this, how it impacts us, and when we can return to normal. As Premier of Newfoundland and Labrador, I want to assure you that all steps are being taken to protect our systems and get them back up and running to provide the services that we so desperately need. This is an evolving situation, changing by the minute, not even by the hour. Through the course of the investigation thus far, it has been determined that some personal information and personal health information has been accessed. I know that that sounds alarming and frightening. We do know that there is no indication that the personal information or personal health information has been misused. There's no indication that banking information has been accessed. The appropriate authorities have been contacted and are on the case. High caliber experts are working around the clock, and we have the support of our federal ministers and agencies like the Canadian Centre for Cybersecurity. Just last night, I spoke with multiple national security officials, and we all understand the gravity of the situation, and all efforts are being made to resolve it. I can't thank you enough, each and every one of you listening, for your patience and understanding in these exceptionally trying times. I cannot thank the hardworking women and men delivering care within our healthcare system enough either. You are absolutely our province's superheroes, overcoming every obstacle thrown your way, every challenge, every barrier, to do what you love, what you're trained to do, to care for Newfoundlanders and Labradorians. Because of you, the people of Newfoundland and Labrador still have access to quality care. Thanks to all of you and everyone working so diligently to restore our systems. There is no question the next few days, weeks, and maybe even months won't be easy. We must collectively brace for uncertainty, but know our fortitude, our strength, and our spirit is stronger, deeper, and more courageous than any attacker. We must be united in our resolve. Thank you. I'll now ask Mr. and I'll throw it to Minister Haggie for some comments.
Thank you, Premier. We are currently in day 11 of what is no doubt a very unsettling situation. We appreciate the patience of everyone impacted as we're continuing to work our way step by step through this matter. As Premier said, we can now confirm that some personal information and personal health information has been accessed from our system. This includes some information about current and former employees and patients. This affects Eastern Health for about the last 14 years and Labrador-Grenfell for approximately the last 9. There is currently no evidence of any data being accessed relating to Western Health, and with respect to Central Health, the investigations are still ongoing. Employee information that's involved may include names, addresses, contact information, and social insurance numbers. There is no evidence that banking information of employees was involved. In addition, we know that some patient information is involved. This is made up of the basic information that's typically logged and used when we register a patient for an appointment. That would include name and address, healthcare number, MCP, a reason for a visit, your family physician or referring doctor, phone number, birth date, email address for notification, inpatient or outpatient status, maiden name, or marital status. At this time, we don't have any evidence of vendor information being obtained. An important message I need to give and reiterate here is that we have no information that any personal health information or personal information has been misused in relation to this incident. However, we've encouraged and continue to encourage patients and vendors of the regional health authorities to remain vigilant, as always, regarding their personal information. If you notice any unusual activity in any accounts or your account statement, please contact the appropriate service provider, such as your bank, as soon as possible. From our point of view, we will have questions that you would obviously want answered. We will have material up on our website today by 5:30 for both employees and patients. By tomorrow at 10 o'clock, for those people who feel their issues have not been dealt with by the material on the website, there will be a toll-free number. This will be repeated in our public service announcements going out later on today. But for those of you with a pen, it's 1-833-718-3021. That will not be operational, however, until 10 o'clock tomorrow morning. So at this point, I'd like Minister Hogan to take more insight into some tangible steps we should take in such instances. But just to close by saying this is an evolving situation. We're trying to be as open and transparent as possible with the residents of the province, but we also need to be cautious about the third party watching, literally, what we're doing as we're speaking now. I also want to note that health authority staff, Centre for Health Information staff and department staff have worked literally around the clock and are continuing to do so to restore and renovate our IT systems. And in parallel with that, the investigations continue. So again, I thank those individuals, and I can't say enough good things about them. I'll close now, Premier, and turn it over to Minister Hogan for some comment. Thank you.
Thank you, Minister. And again, I will reiterate what Minister Haggie and Premier Furey has said this afternoon, that data has been accessed. An investigation into the extent of that access is ongoing, but it is important for the public to know that steps have been taken to contain and mitigate any access that has occurred, which includes conversations with the Privacy Commissioner, engaging experts in cybersecurity, and an ongoing RCMP investigation into this matter. I think it's important now to tell the public that it is always wise to be vigilant when it comes to cybersecurity. This just brings it home a little bit harder that over the next coming days and weeks and maybe even months, as the Premier noted, we should add some extra level of vigilance to everybody in Newfoundland and Labrador. Of course, as already noted by the Minister and the Premier, there's no reason to believe that data has been misused, but we should take precautionary steps at this stage to ensure we're all protected to the extent that we're able to. These steps include contacting credit reporting companies in Canada to get your credit report. This is the best way, one of the best ways to identify if an identity theft has taken place, to review your banking information on an ongoing basis to see if there's any inappropriate withdrawals or deposits in that account that you're not aware of or that was not done by you. Of course, if that has occurred and you think or believe that there has been a theft from your bank account or any of your personal information, to contact the police or any other law enforcement agencies as necessary. You can also contact the Canadian Anti-Fraud Centre at 1-888-495-8501. Other things that we may not be aware of is receiving certain pieces of mail to your home which doesn't have your address or has banking information that's not yours. That could be another sign of identity theft as well. And always ensure that any information you're giving is secure as possible. I know during the media briefing and technical briefing earlier today, even things that we hear about, what we might not always do, like changing passwords on an ongoing basis, is very important to do, especially when it comes to your personal information and your banking information. So having said all that, just to reiterate again that we do not have any indication that any information has been misused. We do want to be open and transparent here this afternoon and advise the public what we know, and we will continue to provide updates on next steps in this process as they become available to us. Thank you, and I'll ask Dave Diamond to comment.
Thanks very much, Minister. A lot has been said already in the comments, and at risk of repeating, I will just add a few comments. Obviously, we know any release of personal information creates quite a bit of angst for individuals, for our patients, and for our staff. And we recognize how difficult this news is today. Perhaps not surprising. Many folks in the public may have thought that some of this would happen as part of a cyber attack, and here we are. So we certainly appreciate how difficult this is to hear. In terms of the patient information, I'll just say again, as Minister Haggie mentioned earlier, for patients, the information is basic information that you would provide to a registration clerk if you were coming into one of our acute care facilities, coming in for appointment. It's your name and your address, your MCP number, for example, who you're seeing, the reason for your visit, your doctor, your phone number, your birth date, your email address, the reason you're there, your marital status, your mother's maiden name, race and religion. So it's that basic information that you would provide coming into any of our hospital facilities. We know how difficult it is to hear that, and so as has already been indicated, we have spent today and into tomorrow putting in place some supports, and more information will come out on this. Minister Haggie talked about the 1-800 number. We are also looking to contract credit monitoring, an opportunity for credit monitoring for patients who feel they would want to avail of that, and there will be more information coming out on that shortly. We also recognize that for some, this will add to stresses you're already feeling in the midst of a COVID crisis and other things that may be impacting your mental health. And so we would encourage you to avail of mental health services within the regional health authorities, our Doorways program, our online resources, and to reach out. And over the coming days, we will be looking to find other opportunities to provide mental health support for anyone who needs that. For our staff, as has been mentioned, the information that has been accessed related to staff includes names, address, contact information, healthcare numbers, your MCP, social insurance number, your employee ID numbers, but thankfully at this point no evidence that banking information is involved. The 1-800 number will be communicated, as Dr. Haggie has indicated. That'll be a support for our patients, but also for staff. That information will be communicated in the hours to come. We have contracted with credit monitoring agency, and we will provide the ability for credit monitoring for all of our employees in Eastern Health and Labrador-Grenfell Health, the two regional health authorities impacted at this point in time. More information to come into the evening on credit monitoring and how you will be able to access that without any cost to you. Again, similar to my comments around the public, we know how difficult this may be for some in terms of the stresses and your own mental health, and we will be offering enhanced employee and family assistance program. And again, that information will be communicated to staff into the evening and tomorrow, as these supports get in place. We have, I know, across all of the regional health authorities, opportunities this evening to be meeting with staff, with unions, with our management teams, and doing everything that we can to support our staff, and doing everything in the coming days that we can to support patients as they manage through this difficult situation. I'm going to pass things over now to my colleague in Labrador-Grenfell, Heather Brown, who is the CEO there. Over to you, Heather.
Thank you, David. I, as well, on behalf of Labrador-Grenfell Health, want to recognize the concern and both for our patients as well as our staff that hearing this news has resulted in. And we do join with Health in working collaboratively with them in terms of the services that have been identified, both for patients and for staff. Labrador-Grenfell Health has been working with the Department of Health and Community Services, the Newfoundland and Labrador Centre for Health Information, and the other regional health authorities closely, and are putting processes in place as outlined by Mr. Diamond. We really do want to ensure to our patients and our staff that your well-being is of utmost importance. And while we know that some services have been impacted this week, we want to remind people that your health and safety is of utmost importance. And if you do need any services, please come forward for services. Mental health services are available as outlined with regards to as well as the processes put in place for staff. We will be continuing to work through this together with our staff. As Mr. Diamond outlined, we as well will be working with our staff with regards to updates and providing information and support, as well as with our patients. We regret this incident, and we will be working collaboratively with our partners in the province, as well as with the patients that we serve and our staff as we work through this. Thank you.
Well, thank you, Heather. We'll now invite questions from the media. I think before we do that, we should just say, as an overarching statement, that this is an abundance of caution. We can't comment specifically on security issues and active investigations. We thought that this disclosure today was out of abundance of caution for public disclosure. The exact quantum is still being investigated in terms of the unauthorized access.
Thank you, Premier. We have 7 media registered for today's availability. There will be one round of questions where each reporter will have the opportunity to ask one question and one follow-up. Our first questions are from Peter Cowan with CBC. Please go ahead.
Even though this is described as basic health information, there's still a lot in there that's very personal. For example, disclosing the reason someone visited a hospital could reveal that they've had an abortion, got an STI test, for example. So what would you say to people who are now afraid that there may be very personal health information that is in nefarious hands and may end up being made public?
That's a great question, and we can appreciate the anxiety that this news is causing people. And before I throw it to Mr. Diamond, who can talk to more specific on supports, we empathize with that scenario, but we felt at this point, having knowledge of this, that we needed to disclose it so that people could at least start to begin to get their heads around the fact that this has occurred. But again, we are unsure the exact quantum of unauthorized access at this particular moment in time. But Mr. Diamond, I don't know if you want to speak further to specific supports.
Yeah, thanks, Premier. I think I think this is quite a serious breach, and so that's part of why we want to have this discussion today. So we're in no way suggesting that this information is not quite significant and serious, and so I certainly would feel along the same lines as you've questioned, that this is very significant, and but also, this is one piece of information that could have been accessed. So I think, what I would say is we understand this is a very difficult circumstance. Thankfully, with what we know has been accessed, the personal health information that is available in your registration conversation is limited, but it is there, and there's no denying that this is a very difficult circumstance. And you know, as the custodians of that information, we take that role very seriously, and you know, we're devastated really as the custodians of this information to find ourselves as a health organization and really as a public, as citizens, to find ourselves in this situation. So we're not downplaying that at all, and we feel the pain of what you've suggested.
And I have a follow-up question about the impact of the cyber attack on the services that Eastern Health has been performing, specifically cancer care. I spoke with a woman who's receiving palliative chemotherapy. She missed her appointments last week, and now she's been told there's no time frame for when she might get them again. Can you speak to how those chemotherapy patients are being prioritized, and why aren't more resources put in place to make sure that everyone who needs to get chemotherapy is able to?
Well, I can't speak to any individual circumstance, and I obviously don't know of the specific patient you speak of, but we have actually, since last Thursday, been able to do chemotherapy. We've found some workarounds, and as systems have come back, we've been able to do quite a bit of cancer care. We've had all of the resources of the cancer care program available through the weekend, working into the evening, and you know, we will continue to put whatever resources are required to catch up. And so cancer care has been one of several priority areas as systems come back on for us to put resources to, and as many resources as that are available in the province to do that work are doing that work as we speak. And so we would expect to you know, to hopefully be caught up on those services in the near future.
Our next questions are from Renelle LeGros with All Newfoundland Labrador. Please go ahead.
Just maybe switching gears a little bit, I'm wondering if the Department of Health or Eastern Health or any of the health authorities really have insurance that would cover losses stemming from ransomware or other forms of cyber attack.
Yes, the answer is yes. Cyber insurance in the healthcare industry is relatively new. But we do have, through our insurers, and all of the regional health authorities would have some insurance against this kind of activity. We'll obviously learn through this exercise whether that's enough, but you know, the answer to your question is yes, we do.
And I'm just wondering if government has a plan in place to support fee-for-service physicians, those who had their work interrupted throughout all this, similar to the pandemic work disruption policy.
I believe that's already been enacted, but Minister, I don't know if you can confirm. I'm quite confident it has, but Minister, I don't know if you have a comment.
Yeah, thanks, Premier. The short answer is we do have a work disruption policy for fee-for-service physicians, and that is triggered on request usually from the NLMA, but we can also initiate it, and my understanding is work's going on with that now.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. You've said the government has retained world-class expertise, or I think, Premier, the words used today were high-caliber experts to deal with the cyber attack. You haven't said who's providing that expertise, but local company Verifin, this is right up their alley, confirms that, they confirmed for me anyway, that they haven't been contacted or consulted, either before the attack for security or monitoring, or afterward for advice on what to do. Why not avail of Verifin's world-class expertise?
I mean, right now we're taking advice from experts at a national level, including the RCMP, CSC, and NELCHI's experts, and we have retained the people that they've advised, frankly, and that's been the course that we've taken, and those are the experts that we're following currently. We're certainly open to further discussions with Verifin. We're quite proud that Verifin is from here.
Thank you. And just going back to the insurance issue, is there a deductible required to use that insurance? And is there any estimate yet on what all of this could cost the province, not just security-wise, but financially?
there is no deductible on the insurance, and we've had lots of discussion as the regional health authorities together and with the Center for Health Information and our insurer. So there's no deductible, and that discussion is ongoing. I don't have an estimate of what this is going to cost from a healthcare perspective, and I don't know from government.
No, I mean, at this point, our priority is to restore the system in a secure, confident fashion so that people can get the services that they require. And there will be plenty of time to sort out the costs after. I've spoken with the opposition leaders, and they are both on board with respect to ensuring that we are doing what we need to with respect to getting the system restored, and if that requires expenditures, then so be it. But we'll have to sort that out in due time.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hello. How many people are affected by this? And if we don't have a clear answer, why don't we have a clear answer on that?
We don't have a clear answer just yet because it's an active investigation ongoing, Patrick. I mean, we all wish that we did, but we don't. And out of an abundance of caution with respect to the investigation ongoing and future security implications, we can't comment further.
And at this point, can we say this is a ransomware attack? Can we be more specific about exactly what type of cyber attack this is?
At this point, there's ongoing investigation. It's still considered a cyber attack with unauthorized access.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Hi, thank you. Does this affect, we've slowly seen some services coming back like chemotherapy, radiation therapy. Does this affect the rollout of services or services coming back?
This particular breach per se does not impact that. The breach is obviously a result of the cyber attack. Our systems are slowly coming back online, and as systems do, our services are slowly increasing. We're still in a scenario where we're doing primarily urgent and emergent, but we're expanding. We're expanding every day what we're able to do, and so. In areas where we either have a manual workaround that we've found to be effective, or where a system is up, or where there are procedures we can do without the need, as much need for diagnostic imaging or lab as examples, we've given the go-ahead to programs to really maximize what they can do with the resources they have available to them at any one point in time. So the breach is not connected to that. But certainly, as we are able, over the last few days, we have been slowly but surely increasing what we're doing from a service perspective.
Thank you. And I know we can't put a solid number on just how many people this affects. If somebody's been to, say, Eastern Health in the last 14 years as a patient, should they just assume that their information has been taken?
I think the answer to that is yes. We don't have any more details than that. So at this point in time, we can't say. But that would be my view. But Minister,
go ahead, Minister.
Yeah, one of the purposes of today was obviously to advise the public. But as the Premier said, we're doing this out of an abundance of caution. Again, we have no reason to believe that any information has been accessed has been misused to date. So the purpose is to let everybody in the province know that this has happened and to advise them that precautions should be taken to prevent any identity theft. These precautions should have already been taken by everyone, including everyone up here today, on an ongoing basis to make sure their identity is protected. Now that we're aware that their information has been accessed, it's just an extra sign here to us and to the general public that these precautionary steps need to be taken. So we don't have any information about the number of data points that have been accessed. Again, we're here to, out of an abundance of caution, to be open and transparent, let the public know that these steps should be taken.
And of course, incumbent to that is to not jeopardize the ongoing processes that are in place. And we felt that broad disclosure narrowing when able was probably in the best interest of the public, to the Minister's point.
Thank you.
Our next questions are from Evan Kareen with The Telegram. Please go ahead.
Hi. Is there any indication at this time when there will be more of an answer on whether Central Health was impacted by this?
No, not at this particular moment in time. We will update you when we have something to update. But again, this is an active investigation, and we don't want to jeopardize it with further commentary here today.
Okay, but I just wanted to clarify then, it hasn't been determined yet whether Central Health was impacted, correct?
It's not confirmed at this particular moment in time.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
You mentioned that no information, there's no indication that any information has been misused. What kind of misuse is the government watching for with respect to this information?
Well, I'll get the minister to comment, but as the minister has already said, one of the most concerning things in 2021, of course, as we've seen as we move to a digital age, we live in a digital age, is identity theft, and that would be top of mind for all of us. So as a government, this is something that we are concerned about for the citizens of the province. But Minister?
Yeah, I think that's right what the Premier said. It is the concern is identity theft, and just for an example, why we tell people, I guess it's important to explain why we ask people to check their credit records with Equifax or with TransUnion. Anyone could use this information, any information they have, to steal someone's identity. They could be in the other side of the country, any parts of the world, and using that banking information, that personal information, to maybe request a loan or anything that would affect your credit. So just by checking your credit report, you will see if that information is being used. You'll be aware of that. Then you can call your banks, you can call the police and have it dealt with before anything of severe consequences happens.
Okay, thank you. And was this expected?
No, none of this was expected. Certainly, we weren't expecting any of this, but frankly, no.
I mean, specifically, were you expecting that personal information had been accessed given the cyber attack we're experiencing?
We became aware, as we said last week, of a potential cyber attack, and as the information has evolved, we became aware late yesterday, that this was an issue, and in the workings of today felt it was necessary to disclose. But you know, this is a new area of crime, and we're taking the best advice from people throughout the country, and you know, there's different permutations of where this could have gone and still can go, I suppose. So. But we were hopeful that it wouldn't, but I mean, that was, I guess, a possibility, but we only had confirmation of that late yesterday.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Yes, thank you all for joining. I know this is not news that you wanted to hear. Trust me, it's not news that any of us wanted to deliver. But rest assured, we are working hard and diligently to secure the system, to secure your health and your safety, and we will continue to do so. I'd like to again thank everybody working behind the scenes. This is a complex a file that requires nuanced language, and we would love to be able to share and communicate more fulsome even than we have to date. But in due course, there will be plenty of time to have a postmortem on what has occurred and lessons learned, and to move forward. I'd also like to again thank the federal government for their cooperation. Thank you very much, and we'll have more to say soon.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.